Hi, this is Brian Kim. I'm going to share with you this SimulEYE SimuloRhexis model for Capsulorhexis. You're going to see the unpacking, and then my first impression using this model. You're going to see me performing Capsulorhexis, my standard technique, and then I'll create a radial tear. We'll also perform the little maneuver for a tear out rescue, and also create another Capsulorhexis around the original Rhexis that I did, just showing the maneuvers of Capsulorhexis, and I'll be using the sharp tip Haldey Percar forceps. So here's the model. It comes in this little container, and these are all the ingredients. You have this putty material, you have the base, and you have these little discs, and you have this simulation cornea and iris. And so I'll show you those four components. So basically you take this putty material and you make it into a ball, and then you place it into that suction cup container on the top end. It looks like almost like a snow cone container. And then what you're supposed to do is take the plastic cap and you turn it over and you're going to mash it down. You want to basically get a flat surface with the putty. But you see it's still sticking up a little bit, so I'm going to go to a hard surface, and you really want to mash it down. And essentially you want to mash out any excess putty so it goes out to the sides, and then you can just kind of peel it off. It's almost like a Play-Doh consistency. Just peeling off the excess on the edge. And the nice thing is you can reuse this putty. Now you might say, what the heck is that? That's actually going to simulate the lens material underneath the capsule. And so I think it's really quite brilliant, the design. So here you want to have the blue side pointed towards the cornea. So you can see it's inverted. And then I'm going to place that suction cup with the putty on top of that. And it's supposed to snap into place together here. So I want to put it on the hard surface, and then I'm going to snap it into place. And so now we're ready to go. So I placed it on the SimulEYE plate, and I applied the suction cup. And now I'm going to go ahead and make my 3.0 millimeter keratome incision. This is just the metal blade that I have. I've been reusing this metal blade over and over and over again, so it's really, really dull here. You can see that sudden loss of resistance. Not very good at cutting anymore, but I've been using it for all of these cases. And this is a viscoelastic substitute, and you can get this for the SimulEYE models. And again, you start on the other side. Again, remember the container is completely empty. There's no viscoelastic. So I'm filling it completely with viscoelastic. And this is the surface coating gel. You can also get this with SimulEYE. And the point of this is you can place this gel on the surface of the cornea. And what that does is, sometimes when the cornea is dry on these SimulEYE models, you can get kind of weird reflections off the microscope light. And sometimes you can have these little fine, almost like abrasions that can show up on the surface of the eye. It's like this imperfections in the plastic. And so when you put this coating on it, it essentially masks any imperfections that are in the cornea. And what's cool, it has quite a bit of surface tension, and it'll actually stay right on the cornea, and it doesn't dribble off to the sides, onto the sclera here. So it's kind of a neat feature of using this coating on the surface. And so these are my Haldey Percars. You can see I'm just showing the maneuvers of my forceps within the incision. And again, you want to pivot, and that's the good technique, instead of moving the forceps translationally, which can cause the whole eye to move. I'm going to puncture the center. You can see how it becomes more concave as I push down. And this is the first thing I'm noticing, that there's a beautiful convexity to the anterior lens capsule, which does simulate the actual cataract surgery. You have convexity to the lens material. And so when I punctured it, actually indented down, punctured through. I'm using my forceps, again, like a cystotome with the teeth closed. I'm able to control the tear. You can see I have great control using these forceps. You can see there's a beautiful delineation. The red is the capsule and the white is the underlying lens material. And you can see I'm within the incision. I'm not torquing. I'm not pushing against the incision. I'm not causing the eye to move. And it's really about pivoting within the incision, keeping your forceps straight up and down and grasping the edge of the tear very carefully. And I'm going to try to make sure I get a really well-centered and sized rhexis. And you can see as I make my rhexis, what's really, really neat too is there is lens material that's being liberated. So that putty material simulates lens material. And so as you start mucking around and doing the rhexis, you can get liberation of that lens material, which again, really does simulate true cataract surgery. And because that lens material can muck up your view, it can make it hard to see. It might even make it hard to grasp the flap as you're trying to do the rhexis. And so all of that I feel like are real challenges in real eye surgery. This does a pretty good job in simulating. And again, I think that if you put more putty, you can actually make the surface of the lens even more convex, which can maybe almost simulate an Argentinian flag type of scenario, or at least some type of intumescent lens situation. You can see as I'm going along, I'm having more lens material that's coming out, and I'm just trying to give myself a better view. I push some more viscoelastic in, but the point is that lens material does muck up the view. It makes the viscoelastic cloudy. And again, all of that is really quite beneficial to recreate some of the challenges that occur when you're performing capsulorhexis with the forceps. And so this is the end of the rhexis. It completed the rhexis. I take the flap out. You can see there's a perfectly sized and centered rhexis. And I wanted to make sure that this really does simulate capsulorhexis, and I feel like it does a really, really good job. So I use the sharp tip Haldi Parkars, and you see I'm going contra-incisionally, and I just punctured through the capsule. And I did that on purpose because I want to create a runout. I want to create a capsule runout. And so first thing you want to do is you want to flatten the anterior capsule. So I'm going to push some more viscoelastic. You saw I laid the flap back down. I'm going to go back in with my forceps, and then you're going to perform the little maneuver. You're going to grab right at the edge of the tear, and then you're going to pull towards the center or even a little bit towards the back, almost backward. And as you do that, you can see that the tear turned and made a little bit of a U-turn and came around. And so now just, again, showing the great control of doing the capsulotomy with these forceps, I'm going to go ahead and just continue the rhexis in that little sliver of capsule. I'm going to try to take that all the way around 360 degrees. And again, the consistency of the capsule is actually pretty realistic. It's not stiff and plastically like some other models. This capsule material does more similarly recreate and behave like actual capsule tissue. It doesn't flop back down, and it's not too over stiff, and it does stay where you leave it, which is again pretty consistent with a real capsule tissue. So I go ahead and make a right-sided paracentesis incision, and I'm just going to see and illustrate how I'm able to continue the capsulorhexis with these Haldi Parkar forceps. These are supposed to be able to be put through a 1.5 millimeter or 1.2 millimeter paracentesis incision. So I just wanted to illustrate how these Haldi Parkar forceps, because of the very thin profile, I'm able to actually do the capsulotomy through a small paracentesis incision. Again, not a 1 millimeter, a little bit bigger than that. And you saw I was able to continue that rhexis about a quadrant there. With the teeth closed, I'm able to manipulate the flap. You can see how it moves around. Again, very similar to human tissue in this regard. And I'm able to carry out the remainder of the capsule, trying to keep a nice size and centration and making it fairly symmetrical all across the capsule. So you can see here, again, I'm showing how the Haldane-Perkar forceps is able to open and close very easily through that small incision. So again, this is my first impression of the SimulEYE SimuloRhexis model. I love the putty concept. I didn't really understand what that was all about, but once the putty was put into the receptacle and we placed the capsule, that capsule disc, each kit comes with quite a few capsule discs, so you can actually do it multiple times. You put the capsule disc in the iris cornea chamber, you bring the two together, you snap it into place, you fill the eye with viscoelastic, you make your incisions, and I love the convexity that that putty creates. That convexity does really simulate what a natural lens is. The lens is convex on the anterior capsule surface. And so you want that little bit of pressure. And so when I indented into the capsule, you could feel that pressure from the lens was pushing up. I punctured through. And as I made the capsulotomy, I did feel a slight radialization force because of that putty. And so I can imagine, again, if you had even more putty and when you snapped into place, you can even make that surface even more convex, and that would actually recreate more of that radialization force, especially in cases of like an intumescent lens. And so again, the lens simulation is great because when you're making the capsulotomy, that putty material becomes liberated. It does affect your view. It almost behaves like cortical and epinuchal material as you're trying to do the rhexis. And pivoting within the incision, of course, is just fundamental techniques to do capsulorhexis. The forces as I pulled the capsule and the flap, again, very similar to what a true capsule felt like. It stayed in place when I was repositioning. It didn't try to flatten out and it wasn't stiff at all. And so again, this is in the name, SimulEYE is supposed to simulate real cataract surgery, and in this case, real SimuloRhexis. And I feel like, I don't have that much experience with models, but this one for sure does do a great job in simulating the Capsulorhexis. I've had just a couple of experiences with different models, but this one, in my opinion, is by far the most realistic as far as the grabbing of the capsule, the movement of the capsule, the behavior of the capsule and the flap tear, again, the convexity of the underlying lens material with the putty. And again, that's titratable. And I think that's the beauty of this particular model. And I do recommend it highly as a result. I feel like anyone who's practicing capsulotomy would benefit greatly by using this model. And hopefully it'll translate to, in real patients when they're doing cataract surgery. You saw that I did the little maneuver as well. Again, I felt like that also was fairly similar in the texture of the capsule itself. Of course, the only thing it really didn't do is it didn't really recreate the zonules, right? When you go really peripheral, you'll start pulling on the zonules and you'll have actually loss of some of that counter resistance when you go too far. Of course, it didn't really simulate that, but other than that, I felt like it did a really great job. And so, again, this is my first impression of the SimulEYE SimuloRhexis model. So I hope this was helpful to you, and I thank you for your attention.